6:30 by my phone. Let's call the February 2001 meeting of the Health and Human Services Board to order. Thanks everybody for coming out. It's a cold night to do traveling. Okay.
Roll call, Chuck Van Etten,
Here.
Jennifer Warnick, Carol Pearson,
Here.
Lorraine Boucher,
Here.
Tweet Schuman,
Here.
Dale Olson,
Sorry, here.
Don Pettit,
Here.
Sabrina Dunlap,
Here.
and Dale Schleter.
Here. Okay, thank you. Ooh, I asked if this meeting has been properly.
Yep.
Has this meeting been properly noticed to the public?
Yes.
Okay, thank you. And the meeting agenda, is there any comments or changes there? If not, I call for a motion to approve the meeting agenda.
So moved, Mr. Chairman.
I'll second.
A second. Okay, everybody in favor, say aye.
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 Motion passed. Audience recognition. If you wish to speak to the Health and Human Services Board, put your hand in the air and we'll take turns. Please limit it to 3 minutes each person. And when you come, state your name and address, please. Thank you.
I'll start. The 30 Road address is 16081 Park Road, Apartment 3, Hayward, Wisconsin 54843. I came here tonight to continue to adapt and evolve and heal within my recovery. Joe Bodo, who is here, is a representative, works for the Health and Human Services, that has counseled me in the past. My sobriety is going well, everyone.
Good.
In the means of definition or recovery in my body and healing, I would let you all know the fresh produce section at Mark's Place is doing good. Almost within the state foods that I've eaten, they're doing good. I've had a few complaints in reference to monoglyceride, which is in a lot of food. Something that I'm concerned about. I had mono when I was younger. I was sick for a month. I noticed in a lot of the ice cream, in a lot of the processed foods. I just wanted to bring that up. Other than that, in reference to Health and Human Services, so let me take care of well. I'm still filing, still working out problems with disabilities, but though I believe, as I told Joe in the past, I believe I still can work. That's why I come to these meetings to apply myself, as I applied at the Center County Jail for jail staff, to work with the jail staff and or maintenance. So I mean, I guess I kind of gave up on, or not kind of, I gave up on the self-employment. See, after going to the little bit of schooling I have, the difference. I like the union aspect of life. I feel that I missed out a lot growing up. I learned a lot growing up the way that I did, but in reference to economic development, I think my skills would be better used in the county than working with others rather than being self-employed. With that, transition to relationship with my daughter and the child support case as well. So in reference to Health and Human Services, I've been working with those of you the best I can when I can, and trying to help fix refile a motion as I have been, within, for my case. Promotional change because of the fact that I don't believe it was filed properly in the past.
Okay, it's
Yeah.
three
Yeah,
events.
I would like to have, if we go through it again, and find no respect from those of you that work within the district, and also myself, in the manner of defining.
Okay, thank you very much. Anybody else in the audience? Okay. Minutes from the previous meeting, folks have had a chance to read them. Is there any
Motion to
changes?
approve. Second.
Motion approved by McPherson, and second by
As presented, yep.
Truman. Everybody in favor, say aye.
Aye.
Motion passed.
Aye.
Thank you. Committee reports. Maureen?
Yeah, I'd like to, give a report that was given to me by our health, community health director. COVID-19 testing, LCO COVID-19 team has tested 109 patients with COVID-19 in the past 2 weeks. We had 8 positive tests and 101 negative. This represents a downward trend. A month ago, we were averaging between 2 to 3 positive tests per day. This may be due to the number of patients who have previously contracted the disease combined with COVID-19 vaccinations and continued adherence to CDC guidelines of hand washing, social distancing, sanitizing, and limiting groups to less than 10. We may expect a surge in a couple of weeks following social gatherings during the Super Bowl, but we did not see this surge after Christmas and New Year's celebrations. The COVID-19 vaccinations. LCO Health Center has administered over 800 vaccines to date, including the Pfizer and Moderna vaccines. We're vaccinating 40 patients per day this week and have scheduled a vaccine clinic day for February 17th. At this time, we will be administering 240 vaccines. If this event is successful, we plan on repeating this event on Wednesdays for the next 3 weeks. LCO patients can call registration to schedule an appointment during these vaccination clinic days. So that was an update where we're at with COVID. And we continue to practice the safety measures all the way across the board in all our entities. So we're trying to keep those healthy measures taken and keep promoting that. We tried to, like I said in the last report, our educational facility, our essential workers, all our healthcare providers were on top of the beginning phases, and our elders, the most at risk with their health. Now we're going down to the younger ones, younger adults. So we're just going to keep moving forward as quickly as we can. I think a lot of our people have overcome some of those fear factors that were there initially, and have come to realize how serious this disease really is and how we've lost some of our people. Yet those who have been sick, maybe some of them they weren't as severe as others. But me personally, I had experienced that with my mother, and I know exactly what this disease will do to you. And going all the way to the ventilator to everything. So I know how serious this is. And thank God she's still alive. So we encourage our people to stay safe and do what they can to slow this curve down. There's another wave coming, we know that, so we have to prepare for that also. So those booster shots will be given later at the end of summer, fall, around that time frame, to be able to build up for that. We have our daycare facility completed the construction piece. Now we're working on the director and the staffing for it so we can begin the operation. So we're still in that process yet for that and the fire hall. And we're going to be working on building up those programs now. We have a lot of efforts being made as a young man here that just spoke. Well-variety, sober living. We want to really put those efforts into how we can help people. We supported 10 more beds down in Tennessee, so we're sending our members down there for treatment and for some of the aftercare and some of the detoxification that they need, but to help them through those needs that they have in that addiction stage that they need that support and then to bring them back home. And we're still working on some of the pieces for transitional housing. We've got some plans in place to set up to help more of them as they come home. And then we are moving our women's shelter, I'm not sure if I mentioned that last time, to another site. We're moving domestic piece and opening up the women's shelter where it's located right now to have more children and mothers. The men's shelter is still servicing the men who need that support, and we're trying to pull in all the resources that we can. So those are some of the things, and we're trying to work on at some point, and I'm not sure how we're going to keep trying to do things for detox, have a facility for that specifically, and a treatment facility somewhere in our region here. So we're still trying to work on those measures, trying to help people. We just lost another young woman in our community from the tribe that through addiction and those things that we're battling with out there in the community. I think that pretty much covers where we're at right now, and we'll continue to offer any support we can to our kids through the Boys and Girls Club and through our school system, and trying to educate them the best we can right now.
Very good. Officer
Lorraine, I'll just add on to that we have a significant homeless problem as well
Yeah.
on the reservation. And I know Lorraine mentioned that, but until we get our women's shelter completed for the domestic abuse, we've been having to house some of our people in motel rooms in Hayward, and that's a significant financial burden on the tribe. But yet, it's hard for us in weather like this to leave people out in the cold. They call or they come into the office and claim that they're living in their cars or they have nowhere to go. So it is significant, but we're working towards that. And I just want the community to know that that is still a big problem in the area.
Mhm.
We're also putting more effort into refurbishing some of the houses that are boarded up right now, and so that we can get more of our people into those homes. We have limited workforce in some of those areas, because some of them are working on the construction pieces that we have going. But we have to go back and fix those homes up for whatever reason they were boarded up. Now we gotta try to speed it up more so we can get more people into housing that need that. So we're trying to do things in different ways to address what we're seeing.
It's obvious you're thinking out of the box. Well, that's
Yeah.
great. Are there any other questions or comments? Anybody online?
I actually have a question. This is Miss Pettit.
Go ahead.
I thought the new building that was on Trapani and Framo by where the new daycare was at, where the daycare is at, was that not to be a COVID-19 building and available for the public if they needed housing, extra spots?
At first, we were gonna try to utilize it for that, but then it turned to essential workers that need to work and need that childcare. That's the direction it went in.
Is there anybody in that building at the moment?
No,
So if there's no, is there rooms in that building, or would COTS be able to set up for the homeless?
we have some other housing available, but that's not the place for it. That's gonna work now for the children that will need that care.
Okay.
Anybody else online? Okay, thank you, Lorraine. Senior Resource Center, I guess they sent us something by email, that was it. Did you receive anything else from them?
I haven't.
Okay. Economic support,
Okay, we have Shauna White, our Economic Support Supervisor, here to present a year-end report of the Northern Income Maintenance Consortium with a twist with Sora County information in there. And this was a report that was shared with the with the county directors at our Northern Income Maintenance Consortium Director meeting, and then counties have the option of presenting this to the boards. So Sean is going to present it tonight.
So, like every department in our county, 2020 was definitely a year with many challenges, and we're still facing some of those same challenges with the health emergency. With Badger Care and Food Share, renewals were postponed and then started again and then postponed again. Healthcare coverage, just so you know, right now with the pandemic, we're not able to close down Badger Care for individuals unless they are deceased, move out of state, or de-request those benefits. So say you have an individual that when they applied, they were unemployed, no income, so they came in and applied for Badger Care, received that assistance. Now they're back on their feet, they're working, making a good income. We're still not ending that coverage for that individual. So it's been a real blessing during this pandemic is to continue to maintain that healthcare coverage for individuals. On that note, we just received information this month that the federal marketplace is also opening up applications. Normally that's at the end of the year, along with your Medicare enrollment. There's legislation that was passed to open up the marketplace starting February 15th, and that goes through May. That goes through May. With those, there is a little bit of a workload involved with that with the consortium and here in the county. It's the first time that we've ever extended those applications, so we're not really sure, how many people will apply, but we're hoping those that are not receiving healthcare coverage do apply through the marketplace. And if they are under those income guidelines, that they come back and are reevaluated for Badger Care coverage. Also, with the MAP program, that's an elderly, blind, and disabled program. During the pandemic, the work requirement for that program was waived. So individuals are not having to do an in-kind work requirement for that program. Healthcare premiums during 2020 and 2021 thus far have been suspended. So we're not collecting premiums for Badger Care. There was expansion to the presumptive Ebt Medicaid eligibility. Also, most of this last year, and we just got notification that it's in place for February as well, households have received the maximum food share allotments for their assistance group, which is also, again, a huge help for families. So say your group only, you're a single person and you're on Social Security, your monthly benefit may just be $16 a month, but right now through the emergency, we are supplementing that food share and giving those individuals the maximum for their food share group size, which for a single person would be $204. Big help there. Ebt benefits, those were the benefits for school children, especially when they were, when the country was actually in lockdown and kids were having to receive their education solely at home. That was a program to get anyone that was receiving reduced or free lunches through the school system. They received these food share benefits. It was a challenge again to get those benefits to households. If they were currently receiving food share, it was really easy. They were just added to their PEBT benefits were added to their food stamp card. Those that had a case with us in the past, we were able to issue those benefits quickly. For those who had never received food share benefits, but were receiving reduced or free lunches, those took a little bit longer to get that help out to those households, but over the course of a couple months, we were able to do that. The 6-month food share renewals, those have been extended. Drug testing for our food share recipients, that is also suspended. So when we do a food share application, we do still ask the question, have you been convicted of a drug felony within the past 5 years? And that they would agree to take a test in the future. As long as they say that they would agree to take a test in the future, we go ahead and push that application through. They also extended the online purchasing. So many vendors are allowing the food share card to be taken online. So that was expanded. That also allows, for delivery of food to your home, which is very beneficial during these times. We receive income alerts through the state. Those have been suspended and we're not processing those. Currently, food share interviews are waived, and this is just, again, another measure just to try to get those benefits expedited to people. We also use the best information available. So if you can just let us know what your income is per hour and how many average hours you work, we enter that information as best available and no longer requesting that you provide pay stubs. So as long as the information is not considered questionable, we just get those benefits issued to households. Childcare rules were waived, authorizations were extended, unspent benefits were transferred to providers in March and April. Childcare authorizations were allowed for virtual school. Childcare supplementary payments were issued to providers, and there was a rollback on childcare policies. Sure.
Do you have a sense of like how many people are food insecure?
I have our numbers, and
Increase of it.
yes. So from 2019 to 2020, for food share, we saw just under a 20% increase, so pretty significant. Luckily for us here in Sawyer County, we had looked at doing a telecommuting policy right before the shutdown started. So I had 2 staff that we had already ordered equipment for, already got them on their way to start working from home. And so luckily for us, we were already planning for that. And so that made that transition really smooth for us. Through the consortium, we have 53 staff working from home. Almost 70% worked remotely in 2020. And here in Sawyer County, I currently have 3 staff working from home. And then I have 1 new worker that just started, and she's working a couple days from home and then in the office. And then I myself work about 60% here in the office and 40% from home. To help our training, we were able to implement a peer mentoring process for new workers. We also had to adapt and do some virtual training, and that's worked out really well. I'm glad that we had some new workers start before I had to hire somebody and start working through the virtual training, but feel confident that it has worked out really well and that she will she'll be able to transition easily into this job. We also implemented a quality control training lead position. So now 2 calls and eligibility reviews are completed for each worker. And we track errors to determine what kind of training we need in the future. statewide improvements, soft skills training was implemented. And then we also received from DHS an IM income maintenance recruitment video. And this last position that we advertised for, we did attach that video so that people hear the term economic support. What kind of job is that, you know? The name doesn't really say exactly what it is. And so by having that video, it kind of gives a snapshot on what the job is all about. It's really an excellent tool. We have a couple of our workers explaining what their job duties are like, and then it actually features them on the call center. The job is very call center oriented. Call center. So just an idea of what we did in 2020. We received over 81,000 calls. Just a little over 77,000 were answered. We have a 96.44% answer rate. The average speed to answer a call when you call in is just over 2 minutes. Doesn't mean that you won't happen to be the lucky person that calls in and has to wait, but generally it's a pretty short wait time. Applications, we processed over 23,000 applications. 99.7% were processed timely. We had over 16,000 renewals, 3,000 6-month report forms for food share. And then just a performance measure, we were recognized statewide for having the highest food share accuracy rate in 2019.
Good for you.
Yeah. And for 2020, our food share active error rate right now is 5.84%. Child care targeted case reviews were put on hold. And then for overpayments and fraud referrals, which part of my supervisory role is I am the fraud supervisor for the consortium. And then I also manage all of our appeals and fair hearings. So we had over 100 investigations completed within the consortium. We had over 1,000 fraud and client overpayments processed. We recouped a little over $700,000 in food share overpayments. And then we had $1,291,000 in Medicaid overpayments. I also processed 15 intentional program violations. And what that means is if you violate the food share rules, then we look at doing an administrative disqualification hearing. A first-time offense disqualifies the recipient who broke that rule. They're sanctioned for 12 months. And then currently we have a little over 4,000 referrals sitting there waiting to be processed. They're not all fraud. Sometimes it's just a discrepancy in what we had as their income, and then maybe some changes happened during that course of the year that weren't reported to us. So it's not always intentional fraud. A lot of times it's, you know, a person gets a new job. We're not always the first person they think of to call and celebrate that news with. So we had 11 new staff within the consortium hired, 11 staff left. Of those, 6 were for other employment or career choices. We had 3 retirements. And again, those numbers, 26,839 monthly average food share recipients, which is an increase of 23% from 2019. 29,180 monthly average Medicaid recipients, and 505 monthly average children served with payments to providers for child care. For Sawyer County, Badger Care Plus cases, and this doesn't include LCO. They have their own income maintenance. They can, of course, choose whether they want to have their case administered by LCO or administered by Sawyer County. Marie Berger, I work really closely with her and she's great. We have a good working relationship. Badger Care Plus, we have 1,524 cases. Elderly, blind, and disabled, and so those cases, those are those MAP cases and also the Medicare premium savings. So your Medicare Part B premium that you're responsible for, we have programs if you're income eligible to pay that Part B premium. So those are the EBD cases. We have 535 of those. And then long-term care, and that consists of your nursing home Medicaid and also your family care cases, you know, to keep people in their homes receiving some additional care. We have 234 here in Sawyer County. Food share cases, we have 1,187. Again, that was a 19% increase from December 2019. Food share issuance on average, $392,000 a month. And again, right now we're just trying to roll with the changes that come down weekly. As long as it's not daily. There was a time there that it was daily changes, but it slowed down a little bit. Food share interviews, we know that they're postponed through June of 2021. Renewals for food share, so far they've postponed those through the end of this month, February. So really proud of my department and the ability to work through these policy changes. It's not always been easy, but they've been fantastic and have done a really good job. Any questions?
Well, it's good to see all that support given to those families and
It is.
through this difficult time. A lot of them lost their jobs because of whatever reason and they needed it.
No, and you don't want to point fingers of like, you know, we did so great and, you know, this organization didn't, but, you know, we heard all those stories about unemployment and how difficult it was to get through and apply and then to get benefits. And I'm so happy that that wasn't us. You know, that we had the guidance and whether it came down from the federal level or the state level to give us the ability to get benefits in people's homes quickly. That's what's most important right now. We'll worry about the other stuff later.
Thank you, Shauna.
Mr. Chairman,
Yeah, that was good. I remember here, in reference to food share, I want to know.
Excuse me,
My name is James Carlo.
we're going to have the,
Yeah, no, I know, I was going to add to what you were saying, and help support in reference to the food share. I want to know the necessity and, you know, be thankful for what I received is the statement. I should say, I'm thankful. I wouldn't be here tonight if I didn't have the food share I received.
no, excuse me, sir. I want to hear from the board members.
Well, one more thing, in reference to
No,
insurance,
no,
I
we're-
think every citizen in the world should have free insurance, free healthcare. You shouldn't have to pay.
Sir, you have to be called down in order to speak. We're talking to the committee right now. Thank
I'm
you.
just wondering why we have to pay for healthcare, those of you who do. Why you doing it?
yeah. Sean, I had a question for you. What, you said you had monies available to pay premiums? Is that on Part B or Part D?
Part B.
B,
Mhm.
hospitalization?
Yeah.
Medicare, is that right, doctor? Part B is hospitalization?
So like the first tier of that program pays for the premium, the Part B premium. Then it also pays for the co-pays. So as long as it's a Medicare billable service, if there's any co-pays, it also covers that.
Wow, that's impressive.
It's a very good program. Lots of people utilize it. The income level is pretty low for it. There are 3 tiers to that program. The QMB Medicare Savings Plan pays for the premium and co-pays. The other two levels just pay the premium, but it's still, you know what a Medicare Part B premium is? It's close to $150 a month.
Right, right.
Are there
Okay,
any
thank you.
questions? Go ahead. Angela.
No, I'm good, thank you.
Anybody online?
Nobody's got their hands up.
I've got just a couple of questions. You said you're delaying the drug testing, but you also said if an individual tests positive and they're the first time they go 12 months without the benefits. If that
I'll clarify that, Dale. So right now, for the drug testing, it's suspended. We're not doing any drug testing right now. We still ask that question. With the food share program only, if you've had a drug felony within the past 5 years, normally you're subject to a drug screen upon application for the program. The intentional program violations, those have to do with violating food share rules. So like applying for benefits, but not telling us that you're working. And then we find out that you are. Or oftentimes it's somebody that applies and they're not being honest with who lives in the household. They're not reporting let's say the child's mother is living in the home, but they didn't report her and she's got a sizable income. You know, if we find that information out through investigation, and especially if they applied and didn't tell us that information, then we would be looking at a rule violation, and then there can be sanctions imposed.
I guess my concern is the head of that household violates these rules and is sanctioned. What about the children? How do you?
Very good question. And I just actually had a disqualification hearing this morning. And even though I reached out several times to the customer, they called me yesterday afternoon for a hearing that was scheduled for 9 o'clock this morning. And, you know, if she would have asked her questions, we could have worked through it, and we did eventually. The sanction is against her. So she doesn't receive benefits for 12 months. Her household still does. So in her case, she had 3 children. They're still going to receive benefits. It is going to be a reduction because her benefit, the amount that is for her, would be sanctioned. But she is still eligible to carry that food stamp card and use it for her family. So after she heard that information, she was relieved. She was willing to sign the waiver. Hard lesson to learn, you know, but went ahead and did that sanction for 12 months and decided not to go through the hearing.
Okay, this really concerns me because I wonder then, instead of X number of food share to feed 4 mouths, now you've got X minus so much, and you still got 4 mouths to feed.
So I can tell you too, Dale, that for me, I have always been on the side of helping people.
No,
No, I just, you know, have to explain my position. When I took over as supervisor, and part of this supervisor position is to do fraud for, you know, the whole consortium. It was a different side of things for me. You know, I look at it as the integrity of the program, you know, and then 15 intentional program violations in a year, compared to the number of overpayments that we process, those are the highest level. Those are for, you know, the fraud cases. We have to go through the hearing process if they don't sign the waiver, and those judges are tough. You know, they want to make sure that this was a case where there was true fraud involved. So it does happen, but not a lot. And I wouldn't want to be the person out there taking this away.
No. Thank you. That's a very difficult position to be in. Thank you for
Absolutely.
your taking care of that and for your obvious concerns. Any other questions?
Yeah, I guess I won't. Tom, does this program play at all into our budget process, or who funds this program, and does the county have any financial with this program, Shauna?
So the budget, the way that that works is that, of course, we contribute to this, to the consortium, but we also receive federal funds and state funds for it. So it's pretty well matched, pretty cost efficient program. Based on the caseload is kind of where we figure out how many staff we need. It's based on the number of cases that Sawyer County has. So the counties that are in the consortium all have a, you know, a number of staff that they have to contribute to belong to the consortium.
Great, thank you.
Okay, thank you. Is that it? Any more? Okay. Paul, so,
No, I just thank you, Shauna.
okay, public health COVID update. We have Julia.
Julia's up.
Okay, Julia.
Okay, can you give me screen share? Thank you.
Sure, 1 second.
Paul.
Enjoy sharing your screen.
Okay. Oh, now I get to find it. Oh, it's this one. And here we go. Hey, good evening, everybody. As of today, we have 1,441 positive cases since the beginning of our tracking, which is coming up onto a year in March. So it's been quite a year, as Shauna has been talking about. We currently have 42 that are active. We did go up in deaths today. We had been reporting 17. We are now up to 19. I just want to let everybody know that those 2 deaths had occurred about 2 months ago, and it just took a while for us to get all of the paperwork through to confirm that they were COVID related. We have some good news in our community right now. When we look at the 7-day moving average, we are seeing that our risk level is going down. We have been in red for the last number of months, which was 25 plus cases per day per 100,000. And now we're down into the orange risk level. We're just inching our way down there. We're at 23.3 per 100,000 cases per day. But the other positive thing that is going with this is the state has also finally reached as a whole into the orange risk level. So overall, as Lorraine was also noting with cases that have been tested at LCO, that we definitely are seeing a lower number of positive cases. So let's continue to hope we're going in that direction. The other thing Lorraine noted too was, you know, we will be watching for a potential surge after the Super Bowl, but we did not have those surges after Thanksgiving, nor did we have that after Christmas. And the one good thing about the Packers not being in the Super Bowl is hopefully we don't see that surge again. So we are not really anticipating that. It does not seem like more people went out to the bar or socialized than they would have normally done. And as everybody is thinking about and talking about vaccinations, the demand for vaccine is far outreaching our resources that are available to us right now. We have been ordering vaccine and getting half or a third or a quarter of what we have requested. So we are it's up to the state to give us vaccine as we move forward. Some of the other surrounding counties are a little bit ahead of us in vaccinations. They did receive vaccine a bit earlier than our county did because they were approved sooner for some reason. And also they were able to order a larger amount of doses sooner before before there was enough vaccinators on the table, that then they started reducing that amount of vaccine that was coming into us. Hopefully that made sense to everybody. And I'll kind of restate that, as the state got more vaccinators in place, more vaccine was requested to go out to all areas. And we very quickly we're asking for double of what the state was going to be getting each week. So the state has an algorithm that determines how they're sending out vaccine. Right now, tribal nations and areas like our community centers like North Lakes are #1 to receive vaccine, and then they distribute it according to their algorithms through that. This week, we are on target to administer across the county 325 first doses and 370 second doses. That's including what LCO will be giving. The other really good thing that's happening is because we were not able to be getting as much vaccine as we wanted to get from a county perspective, the hospital went forward and ordered vaccine, and they were able to get vaccine. That was wonderful. So now what we're doing is pooling our vaccine together. Those of you who might not be aware, we have been working with the Wesleyan Church in Hayward to have a larger clinic. We started out in the health department and soon found out that that was way too tight to get people through there in a safe environment. So we had moved 2 weeks ago to Wesleyan Church. We were able to move people through there very safely and efficiently. And so Hayward Hospital did get vaccine, and this week they will be partnering with us. They will be administering vaccine at the same time that we are. We'll have the same people will come in. We're scheduling everybody the same through the health department and working that through. So we have about 250 doses that we will be able to administer in really 4 hours on Thursday, and those are all by appointments only. So we are figuring that once vaccine becomes more available, we should be able to put 1,000 doses into arms in 1 day. And the other thing to just remember is that not only do we have first doses, but we also have those second doses. So when we talk about numbers of doses that are going into people's arms, if we order 300 today or put in 300 doses in people's arms, that means that in 21 days, we will be putting 300 doses in, plus for those second doses, plus another whatever we were able to get. So say we got 300 that day, it would be 600 shots that we're giving. As we are able to get more vaccine and exceed the capacity of being able to vaccinate at one site, then we will be moving hopefully to a southern part of our county as more vaccine is available, and we can put these vaccines out. We're hoping by March that we will be able to expand into more of the 1B, but that is not a definite at this point. It is something that the state will bring forward to us. We have a lot of volunteers who have also signed up to volunteer. We haven't had as much of a call yet because we haven't had the vaccine, but we're getting them all onboarded, getting them signed up into Weaver, and are getting some training done so that we're all ready to go when more vaccines are available. Anybody have any questions for me?
Do you see more people, Julia, getting more comfortable with that now and wanting the vaccine? Are you still seeing a lot of fear out there? Or what are you seeing?
No, actually, and it'll be interesting because, there is definitely a draw. We have over 1,500 on our waiting list. Oh, and I did omit having this in there. We are moving to an electronic format as well, and we'll have a new phone line set up. Hopefully we'll have that on our website sometime tomorrow. That will make it more efficient for everybody. But Lorraine, I think that we're definitely seeing people that are saying, oh, it doesn't, you know, maybe this is okay, and they're moving forward. LCO is definitely having a great uptake in the vaccine, and from what we're seeing, at least at this point, it seems to be pretty good. I am expecting about 60%. Hopefully, as time goes by, that will raise up to 70 to 75% that who are eligible to get vaccine will choose to get vaccine.
Julie, are you still vaccinating the 65 and older group? Because I think you heard that Lacoudere is going to start with 18 and up. What is that, Lorraine? Next week, I think, on the 17th. We're scheduling by appointment 18 years old and up. Where is the county at?
No, we need to follow the state guidance. So at this point, it's 1A healthcare workers, and then it's law enforcement and fire, and then 65 and older. And so we are still getting some of the healthcare workers and long-term care people, along with some fire and law, but we pretty much have that chunk. It's just kind of people filtering through that we're getting, and they are going to the top of the list. They're being prioritized. But then it's 65 and older is where we're at. And that's what everybody, North Lakes is following that, Essentia's following that, Marshfield, anybody that's getting vaccine through the state needs to follow that. I know, and I think that you still have quite a few elders too, that is something that everybody, I think that's still the focus too for LCO, is to make sure any elders who still want it, get it.
Yeah.
Anybody else? Okay,
Okay, thank you.
thank you, Julia.
Thank you.
Now we go into fiscal. Who's got this?
I got the first one.
Okay, please go ahead.
January 21st, Tom summoned Patty and myself to go meet with him and Mike Keefe, that'd be Patty, our financial manager, regarding the placement costs. And how much they were, and the bottom line was, and how did we get here, and what are we gonna do about it? And so Patty and I walked out of there like going, oh my God, what are we gonna do about it? And I felt like the only thing above that right now was solving world peace, to make a little bit of joke about it. So I go, what are we gonna do? And he wanted me to write a paper to summarize the issues. And I'm going, I respect what, I had no idea how to even approach this. So talked to Patty, talked to Joe, talked to our administration team, and kind of just went over this whole thing, and which led to these list of handouts that were included in here. We don't necessarily have to go through all these tonight, but these are what I shared with Tom about trying to explain the situation with the placement costs and what we have control over and what we don't have control over. And I said, you want this, and we agreed to submit all these. The first one on there is just the 2020 summary of the adult mental health placement costs. What I do want to emphasize, I got to bring this up, I plan on doing the youth and child placements. We have some things to do in those reports, so we'll bring that in next month. And probably there's enough to cover with the adult placements tonight anyway. So the first handout you have, you'll see what this is the final total of the adult mental health placements. You have a second handout that should show from our Northern Crisis Response Consortium what the diversion costs were for all the counties, including Sawyer County. I think there were 77 of them between adults and the youth, and the multiplier is like 1,500 something. And so that multiplier is if they're in a hospital, anytime you diverted somebody, you at least save one daily cost in a hospital, and oftentimes it's more than one. So those are conservative estimates. Just to kind of give you an idea of the cost perspective. The next handout you have, and this is where Joe's going to come in, and we thought this is probably the best way to explain how to project future costs for adult mental health placements, and all that goes into it And the parts we can sort of predict and the parts that are unpredictable. And so this all came from Joe's head. And we had one of our CST coordinator / CCS facilitator who has a degree in computer graphics was able to take the ideas in Joe's head and put this on this nice document for him to walk you through tonight. Joe?
Well, I guess I'd like to start off by saying this is kind of representative of the chronically mentally ill clients, the ones that are on the CSP program. Carol Lund is here from Northland, and Carol Lund is our CSP provider. You know, so this is not all mental health. We have adults that are not on CSP. CSP is chronic and persistent mental illness. That is a long-term diagnosis. We have funding that we have to spend on people that are not in this group of people, just so you know. And this is not representative of any adolescent costs. This was just how I was looking to, how do we get to these high-cost placements that are $1,500, I mean, $1.5 million a year, you know, which can go up on the budget to almost maybe $2 million. This is the biggest thing that we cannot contain, and it's the one thing that's very unpredictable. So if you look at column A is, Carol, you can jump in if you need to with anything here. The number of CSP clients we have in this county. It ranges from 50 to, it hasn't been 60, but 58 at one time. It's close, you know, and with that group of people, those numbers can basically increase anytime, and there is a waiting list. Okay, there's people that, and I'll get into this later, but there's people that move here. Okay, so this census is variable. But I don't think since I've been here for 30 some years that it's ever been under 50. I think maybe when I started it was about 48. So we stay pretty consistent with this number of people for a population of, 16,700 or what have you. Now,
Can I say something?
yes.
So what is your capacity to increase that number?
How, I mean,
The
we can do the
capacity for, because it's an amazingly good program.
Thank you.
Yeah.
Thank you.
Yeah.
And the capacity is, we have people that could use the service, but number one, it's based on how many staff Carol has and availability. And this is a high burnout position. She just had somebody else resign. I mean, it's all, they're always leaving because these are the people that are working 7 days a week, that are dropping medications off on Saturday and Sunday. And they're also doing the mobile crisis. So they're being called to go out at, middle of the night to help do some of this other stuff. So the capacity, I can't really answer that because if I have somebody that gets ordered to this program and I tell Carol, we have to get this person on, it's a little bit of a time, but we get them on. It may be a couple of months down the line, but if she knows we have to get them on, we get them on. So, we couldn't take 20 more people. There's no way we could do that. Might be able to take a couple.
Unless you put more resources.
Unless we put more resources on.
That seems to me to be a good volume.
Yeah. So 70% of that population remains stable with the services I talked about. Case management, psychiatric services, bringing and picking people up, getting them to the psychiatrist, bringing them their medications, all these, assisting them on a daily basis. Now, that would be the group B. Out of that B, the percentage of stable clients move to instability at time, requiring crisis stabilization, hospitalization, and more restrictive. So even those that are predominantly stable have periods of instability. By me calling them predominantly stable, I'm saying they're not really moving up the ladder for that real long time. It's going to be this 1.5 million or 200,000 that is making Tom's hair turn gray. Notice I'm not worried about it. Well, you know, when you're getting close, it doesn't matter. Okay, so we utilize, for those ones that are unstable, we utilize transitions a lot, first case, because we have the facility and it's there. So it's money in the bank if we can use transitions. Let's put it that way. We're saving money. But some of them go to Trempealeau Healthcare Center, or even other facilities prior to Winnebago. And people can move between these levels, but 70% stay stable. They may cycle and have a problem and have to go to transitions for 2 months and then come back, but we're keeping them there. Okay, so we go to C, stipulations and commitment orders. These are the ones, individuals, that are in that program because of an order from the court, a court finding of a civil commitment and a procedure that says they have to do this, all right? So of and that's approximately 90%. So it's not just like we're going out and saying we're doing this. We're getting civil commitments and court-ordered stipulations, which is nothing more than an agreement prior to somebody saying they're on commitment to do the same thing. So we're getting, 90% of those are participating in these services. Now, of that 90% of those court-ordered people, some of them get ordered to lower level standards within the community, but again, they go up and down, and the same factors apply as B. When I initially started thinking of this in my head, I was thinking of the basketball bracket, because I wanted to get to the final four, which in this case is the final six, which is gonna be like 1.5 million to maybe 2 million, okay? But hopefully it'll be less than that. So when you get to that next group of people that move from that commitment, that are under commitment, we have the ordered placements, community-based residential facility transitions, or other private ones if they can't be held here, Trempealeau Healthcare Institution for mental disease, group homes, adult family homes, state hospitals, and those can be both long and short term. According to the statutes, the placements have to be in the least restrictive. So if we've got somebody in a higher restrictive setting, we need to move them out. And the state is aware of that too, the psychiatrist, everybody. So when you're looking at these folks that are in these long-term placements and staying there, they're meeting that criteria. They need to be there, okay? It's not somebody you can just say, well, let's put them back here in the community. Now, some of these people have protected placement and guardianships as well. So now going to the other placements more restricted. We have the ordered placements that are episodic, can be any of A, B, C, and D that get to that ultimate high level of care, all right? Currently, there's 2 clients, possibly 3, and they don't stay there forever. They move back and forth, and I estimate they're like 250 to 500,000. Then we have the chronic and continuous people. Right now we have 4 people. High cost, they're either in this high cost CBRF, adult family home from 600 to 900, the institution for mental disease 350 plus, or Winnebago at 1,400 a day. Now, when people are in Trempealeau County Healthcare or in Winnebago, guess what? We pay the majority, if not all, medical and dental bills. So when they call up and they say this person, has a infection on their foot, and they need to see a podiatrist, and they have no medical coverage, because you lose your medical coverage when you're in those facilities. So while they're in there, they have no medical, so the county's paying the medical. And I ask them, I say, well, do you think they'll take the MA rate, the podiatrist? And they say, we don't know. He goes, why would they? We have to pay them. So there's no benefit to saying you got to take the MA rate. But most of them work with us. So we're paying medical on people. So right now, yeah.
Bill. Joe, where's the CCS program?
That's a whole, those are not these clients. Those are not these clients.
I thought we just learned at the last discussion of CCS and one of those other counties, Taylor counties and that a strong CCS program definitely reduces the long-term
strong CCS
program.
Tweet.
These are not.
This is your money. This is where you're gonna save. CCS helps. This is the major deal. This is bigger than CCS.
Carol, why don't you say?
I was just
Bigger.
gonna say, Taylor County doesn't have a CSP program. they're one of the, I think there's 4 counties in the state that never moved to establish a CSP program, and Taylor is one. So before they got CCS, they had nothing. So for Taylor County, you know, without a CSP, for them, some of their clients, they put into CCS perhaps, you know, it is a case management program that's doing something for them. But the reason that they said that their county is different than most counties and Sawyer is they don't have CSP.
Well, they don't have the number of clients, but here's the whole thing.
Can I have the other one? Joe, when Tom asked me what else are you gonna do, I mean, I was just, I don't know what we can do, and he's like, everything we're doing, I can't think of a thing. I thought of one thing, and there's a behavioral health pack through WICSA, and I know one of the persons that's on the committee. She's a director in another county. So Joe and I called her this week. We explained what was going on. She's got 30+ years experience like Joe does. And we talked about the CCS thing and CSP, and she said the same thing. CCS can help, but this right here is going to take care of the chronically mentally ill, which potentially are going to be your high-cost people going to placements. I don't know what else to tell you.
So this is our plan going forward then?
No, this is where your money's going.
This
is it.
has been in here for years. I mean, CSP programs.
Yeah. And you know, you get confused because, CCS is self-directed. The client makes the decision what they want to do. These people are not able to do that.
Right.
That's why they're court ordered. If you say, no, I don't want to take my medicine. No, I don't want to do this. And I don't want to do that, you know. But, you know, even like Paul said, when we talked to the director in Jefferson County,
Yeah.
who actually has a place in cable and is thinking about coming up here, which would be a great addition to have working. They have 18,000 people in Jefferson County, something like that. 18.
Yeah.
And they have almost 200 people on their CSP program. So, you know, we have a few.
No, I think it's 85,000, and they have 155. And about, out of that 155, well, 5 of them are chronically placed.
Yeah, but we have more, but when you're in the bigger cities, people, the CSP people are the kind of people that are living on the streets, and you don't see them so much, and they don't, you know, they don't get them the services that they need. So this is just the high cost level. And here's the whole thing. What nobody factors in here. Yeah, I appreciate the comment, you know, when you say think outside the box. But when people create all these different homes and all these things, you don't think outside the box because you don't think about the fact that we get a percentage of those people. Okay, when they open up the home over here on the highway for the women and the children, you know how many have come from Minneapolis or whatever, and they come over here and then they end up here and then they end up in my way? Or when the court lets somebody go because they decided to take about $1,000 bond or whatever because they took a car for a ride with a couple kids in them, who do they come to? They come to me. And then we put the money in them. We have them in Trempealeau. We have them this. We have them in that. Or the fact when you have these situations where people are homeless and you know, and the county gets the dole on them and they're chronically mentally ill. It's ours. We had a tragedy the other day, right? Guy killed himself. For whatever reason, killing yourself is a tragedy, all right? Had the courthouse on lockdown and it got terrible, terrible. From my arena, that's never a good thing, okay? Guy killed himself. If he didn't kill himself and they would have arrested him and took him in, do you know where he would have ended up?
With you.
He would have been on my day, on my day. So when the jail bonds somebody out or lets somebody bond themselves out with no place to live in the community and they walk out a year ago in freezing weather at 4 o'clock in the afternoon, they're on us. They're on us. And we keep the community safe. The cops aren't doing it. We're keeping them safe with that. They do it in certain ways, but we're keeping them safe because we're finding a place to put that person in so they're not doing another taxi job. So this is the unpredictable thing. And you don't realize that the more you have this and the more you bring people here, and I'm not saying you don't bring them here, but this is the cost of doing business. you know, and nobody testing for alcohol, nobody testing for drugs anymore with that program or probation. Do you think people aren't doing it?
Okay, Joe, so,
You know,
so now where we're at is we got 4 clients that are,
high cost.
high cost placements. And one of them, one of them that they recommended, that we put them in a place and have it staffed 24 hours a day, and it costs like $3,000-4,000 a day. I can tell you I can't go into details, but I can tell you vaguely that Joe and Alicia and I listened into the call about some of the circumstances around this person, and they were magnificent. And one way, and I have a comment on one of my sheets about this. It was unfortunate that this individual did something, and the plan that was in place just collapsed because of that. And I kind of wish I could go into detail. I know I'm talking cryptic, but it was just an example about the challenges that these guys have to deal with and the gaps in the system that we have absolutely no control over that lead to higher costs.
Well, we deal with
They
criminality.
were on the verge of having that thing solved.
But we deal with criminality because the system isn't dealing with criminality, because they're letting everybody off. Probation told us, oh, we were told not to revoke. That's what they said in that conversation, that we were told we're not this probation, but the other probation. So the chronically mentally ill person does not end up going in jail, even Mendota, for the criminal stuff. They end up on the street.
No, the person wasn't get revoked and could go to Mendota, but because what happened, they decided, no, there's not gonna be a criminal consequence. So what I learned from that, if I'm ever in jail or in prison, I know what to do to not have to go in. But it's absurd, and I don't know how. I was really frustrated because he had called me in. I came back in the office. We were problem solving this thing and going, and this is in the middle of town going, what are you guys going to do about this stuff? And I'm going, I wish y'all could hear what just happened, and we have no control over it, none. And it's probably going to cost us more. When Joe and Alicia, with the time they put in and their experience, I saw the whole thing. It took an hour, and they almost had the damn thing solved. I guess I don't want to get in a whole lot of war stories, but it's not that easy. What are you going to do? It's complex. And we want to solve this as much as anybody. We talk about this constantly. I can't tell you how much we talk about saving money. And you guys, some of you have heard me say this before. When I first moved to this county and I was working for Carol at Lutheran Social Services and later Northland County, I met Joe right away. And Joe right away on those calls, and I had to sometimes be on call to respond to crises. I thought the Sawyer County was cheap as you know what, but he was just being really frugal with the budget about if you don't have to place somebody, don't place anybody. And I never, he can tell you, not even a handful I ever said we have in place. Right. But the point is, the culture here, even before I ever came here, was about really being disciplined about the budget. And Carol's the same way. But this stuff is complex stuff, and I wish there was a simple solution. And I feel like the stuff that I put in here is like defending what we're all doing to try to curtail the costs. And so when you're talking about how much is it going to cost for these placements, this is about as close as we can get to predicting it right now. What Joe didn't talk about, here's the CSP population. But over here, there's other community referrals. If somebody just comes into the county. Mm-hmm. Like for instance, the one that Joe was talking about, last year, it was 4 o'clock in the afternoon. I'm upstairs in front of the upper desk. This woman comes up the stairs with a bag of clothes. And I started engaging her in a conversation, and she said she just got let out of the jail. She was homeless, had no place to go. It wasn't hard to tell that she was chronically mentally ill. I contacted Joe, and then we collaborated for about an hour to get her placed. And that cost the county a lot of money. But we would have had, we might have still had to deal with it, but the person just got flipped to jail. We had no warning, walked in here, and we had to deal with it. And I know, Dale, sometimes you get upset because we complain about something, but this is the reality of what we're dealing in. And I can't tell you that the stress that our staff is feeling right now about trying to, you cut me off, all right, go ahead.
I just have, I've been on this committee for many, many years. And my question was, a long time ago, if you're not a Sawyer County resident, you know, and we can't ask for that because anybody who lands here, being an hour from the time a crisis happened, it becomes the county's responsibility. And a lot of people don't understand that. When a crime or a crisis happens, it becomes our responsibility financially and every other way. So you can't ask even for, you know, are you a Sawyer County resident? So when they talk about your tax dollars being spent, that's the problem right there. And then the court ordered stuff, we have no control whatsoever over that. It's dumped in Joe's lap or Carol's lap, and they have to go with the court orders. So there isn't, but one thing that's always bothered me, why do these institutions take their medical coverage away from a client when they're entered in?
Yeah.
What is the thinking behind
I don't
that?
know.
Yeah,
Oh,
Does anyone know?
no.
we understand the problems that you guys are facing. They're horrendous. We've had no idea what to do. These problems exist. I was kind of hoping tonight that we might, do we need to change our way of thinking? Do we need to try a different path? Is there something we need to change in our department, Health and Human Services? Or do we just soldier on and keep going in this direction? And it's something we're just gonna have to live with.
Yeah, Mr. Chairman, let me tie into that. That's perfect. You know, I really appreciate the passion we have here. And I appreciate what you do, Carol, with the CSP program. I know that's all working, but we're not here to get all worked up. We need to find a resolution for this. We need to see how we can cut down on these high-cost placements or try to solve this somewhat. Because our budget is not gonna sustain this.
We understand that. Here's,
And you guys get all worked up and all defensive because we ask questions.
If somebody
No, you
needs a
don't-
certain level of care, how do you not give them that level of care?
Right.
Hang
Well,
on.
I agree.
Let's keep calm.
okay, the point is, there's a whole lot that we don't have control over. I'm trying to point out all the things that we do have control over. On this one handout, I did not plan on sending this out to you, but when I was debriefing with Tom, I was using this as my talking points when in a cool down period with him, like, how do I explain this to him? And the first thing I set up here is placements. Maybe I should go through this because it might answer some of your questions.
Mm-hmm.
The placements. If you want to know other stuff we're doing, you've seen this before, here's a handout. I'm not going to go through it, but here's some of the stuff we're doing on responding to behavioral health. Also, I want to say this. I knew this before I came to this. I became the director, and I've seen it clearly every day that I've been here, that Health and Human Services assesses, discerns, and scrutinizes least restrictive placement necessity and efficacy, and process continues throughout placement. They're looking at it all the time. How can we save costs? But again, it's with limitations and things that we can control. And I put down on here, and this because I knew this was going to come up, differentiate what we have control over and what we do not have control over. And this one was just really basic. The nature versus the nurture, the organic, genetics, biochemistry, contributions to mental health and substance abuse. We can't control that. Maybe some psychiatrists give us some medications to kind of help curb that a little bit. We don't have control of that. The other one is nurture/environment. The trauma, the psychosocial, economic contributions that they bring into here, their life circumstances that contribute to mental health and substance abuse problems. We can't solve that. They're bringing this stuff to us. And if it was that easy to take care of this, there's a big shortage of therapists, but there's enough out there. If you saw them for a few sessions, you could solve all this. It's not that easy, especially when people are chronically mentally ill. And the overall thing here is human behavior and unpredictability. Okay, so then I have challenges in the future. And one of the things I've said at the time, and we've talked about it as staff, I know the staff gets it, is and I'll say this. The first one here is employee retention recruitment, job market supply and demand, county employee compensation limits, and double positioning training. Just finding therapists, well, we're not going to hire them here anymore, but in the community. Joe, you may have gotten this email today. We just got something from the Wisconsin Office of Children's and Mental Health about the shortage of mental health therapists in the state and how it's affecting everybody, what some of the solutions are going to be. I have little control over that right now, other than saying some things about it. The second one, well, here, I will say, this is a tough situation we're in right now, and I've talked about this before, but we have retirements and resignation and succession planning. I'm not going to be here much longer, maybe a few more years at best, unless you guys excuse me for whatever reason. But my concern is, really, is what happens when Joe's gone, and and Carol's gone, and I don't know whatever Alicia might do. I'm telling you, if you think it's bad now, and I'm telling you this passionately, I'm not trying to cop an attitude, but I'm really concerned about this. And as I think about this, I keep going, what do we have control over, what we don't? This is some really serious stuff, and anything I can do with that time I'm here, and Joe and I are having some really good conversations about what are we going to do about transitioning when we're gone. I'm the least important person in this room. Joe and Carol, are right up there in what they're doing. My position is trying to plan, how do we take care of this stuff right now? And I want everybody to understand how complex it is, and the unpredictable, human behavior is unpredictable, and there's only so much we can do. So I talked about, even with Joe, I don't know, when he's gone, I don't know if we're going to have the same kind of position. We're probably not going to find somebody that's going to do what he's doing. Me, I'm not that big of a deal. Whatever happens if Alicia leaves. And the reason I'm saying is the job market is really low. This is not, I'm serious, finding people with these types of credentials. Again, I don't know what the future of CSP is going to be with Northland, how long that's mobile crisis stabilization, transitions. In here, you guys can read this on your own. WICS have put together a mental health crisis services issue paper that they're going to be using with the CAP team. So tweet, I'm sure you've seen this and read this. This is something hopefully you'll advocate for when you meet with the state representatives. And they're really emphasizing having more beds available and increasing MA rates. Time out.
I have a question online.
Okay.
Dawn, you have a question?
Oh, boy, ever. Okay, this is where I'm gonna start with it. We have a mentally ill person. If they're Sawyer County pays, if they're Sawyer County residents, if they're a tribal member, does the LCO tribe health insurance kick in anything for that tribal member? Is it just solely a county expense? The other thing is, we need to start knocking down the doors at the Hill in Madison. This has to end now. I've been on this board since last October, or October before that, and all I've heard is that we're going to the Hill, we're going to the Hill, we're going to the Hill. It's time to do something, because this is out of hand. We cannot, there is no, I personally know that once certain members leaves that courthouse and go home to their families that work in that department, do not get a break. They leave the job there and go home, and it continues. And sometimes it's all night long. And then they come back and serve their community once again at that building. If you lose either of those two individuals, Mr. Bodo and Carol, as Paul Grahovac has said, you do not know what is going to come upon you, because these people are doing jobs beyond their pay and their dedication to the county. And I'm at the point where I don't want to hear about we need to go and lobby. We need to go and lobby. Lobbying time is done. It's we need to get some money, or does our county have to go belly up? Because we cannot do this any longer. We're taking money from Paul to pay Peter. We cannot do this. There has to be funds coming. If it's tribal entities or tribal members, I don't know what their percentages of, but I know they have health coverage. We have to get, is there a psychiatrist hired by the county any longer, so that if they're in a moment of crisis, that there's someone that can talk them down? I don't believe that position is filled. There's many ways that we can go about this, but it is not, like Paul has said, there is nothing they can do about the pandemic and the social issues that are ongoing and the mental issues that are ongoing from the pandemic. And then on top of it, you have the opiate epidemic. These people are holding on by strings. They don't know which way to turn. We, as the county, no matter what, are responsible for them, if the money's there or not. That's all I have to say.
Did you say Patty's online?
Hi, yeah, I just wanted to address the question that was asked previously about why do they lose their medical coverage. That is actually something the fiscal unit has been asking for quite some time. And the best answer that we could come up with is that we actually asked, can't we at least take the federal drawdown of medical assistance, but the state has to accept assignment and take the other and write off the other percentage, and they are not willing to do that. So they refer it on to us. And that is one of the things specifically that we have lobbied for, that specific thing, that if you're not going to help us take these high cost individuals as a state cost, how about at least letting us have some medical assistance for them? That was the second thing we specifically lobbied for.
And what happened, Patty?
We don't get answers from the state.
Okay.
We're told that it takes forever to go through the legislature. I mean, they seem sympathetic when you're talking to them, but nothing ever happens.
Okay.
Well, you know, the whole CPS thing, how long that took to get that changed, but can I just tell the creative efforts we have tried?
Chairman Garrett, committee member here.
Excuse me, no, sir, please be quiet.
The county,
You have to be quiet, sir.
Human technology, human interface.
Okay, hang on, be quiet.
It failed to read for enough programming properly. State identification, social security number. I'm just telling you, that's why it failed. I was one of them who got almost killed by that thing. Almost had a brain hemorrhage because of a This is what happened.
You're gonna have one down and be quiet. Otherwise, you have to leave the meeting.
That's the problem.
Okay. You're gonna be quiet, you can stay.
Communication. Federal level, law enforcement level.
Okay, you're gonna have to leave.
You allow people to program emails. Yeah, that's fine. Just send me out. I'm the same guy. I'm like hard worker. Brain aneurysm, computer program, influence, voices everywhere, Christianity. Get back to that.
You have a place to go.
Okay, Chuck.
Real quick, and this may be, a dumb question. What happens when a county can't pay?
Yeah.
If we can't be the only county in the state of Wisconsin that's having this issue.
Yeah, and we're kind of leading up into that. If
Okay.
we just kind of move through quickly the rest of the material, Paul, and then we'll get to that point.
These are things that we tried. And I wish I could add to the list, but this is, so. Back in April of 17, there wasn't any history of the, I was aware of the county going down and talking to the legislators. So myself and Patty and one of our, our CPS supervisor, Carla, we went down to Madison, talked about CPS, and also started talking about all this stuff right here and saying, you know, we're having a problem. And then 2 years later, the county did finally formalize and put a CAP team together. And I went down with them again, and Joe was down there, and we made the same pitch, okay? And now you're on the third year, you guys. So we've done that. We've also collaborated with the Hayward Hospital and law enforcement to improve the behavioral health crisis response. We've, Joe, especially I've been on some of these, Joe is on this on a regular basis, the COVID-19 Crisis Network every Monday throughout the state. He knows what's going on. I mean, what we're dealing with is not that unusual. So if there was a solution out there, I think he would have picked some of those up from those phone calls because they're problem solving all the time about this stuff. We also had a cost containment consult about the placements. These are big wigs from the state. We met Langston from CCS. We had this Carolyn from the CRS, that's the Community Recovery Services Program, and Brad Munger from CSP. So we're explaining everything we're going, including about this one person you're recently dealing with, and there really wasn't, they didn't have a solution. These are the upper level people in the state, the DHS. We went there and talked to them and really came out empty-handed and quite disappointed. We've also collaborated with an organization called Behavioral Health Providers. The emergency department at the hospital is working with them. This Karen Bundy, and they're providing telepsychiatry help in the emergency room in case somebody comes in with some behavioral health problems. They're just starting right now. Joe and I were talking to Karen today about something that maybe that could have gone better in the ED, but she said there's been I think 5 times they've been involved and 4 times Joe didn't have to call. So I kudos to the hospital for having this in place, but I think there's going to be some bugs. We have to worry out some bugs about how that's going to work with how we handle crisis here. And also the one I was trying to think, what else could I possibly do? And I mentioned it earlier that I contacted a person, the director from Jefferson County, who I know is on the behavioral health pack for WICSA, and you know how they're handling behavioral health and out lobbying with the state and stuff, and going, here's our situation. And we got some pointers about some placements that might help with a couple of our people that might reduce the cost a little bit. But again, she emphasized the importance of CSP over CCS. CSP should be the central part. CCS is just another adjunct that can help out, but really CSP is your. This is where you're. I know we're in a financial crisis with this right now, but if this weren't here and this were to collapse and these people didn't have any support,
You would not be able to serve those people on CCS. Just so you know, they're not there. We have plenty of Native Americans.
Excuse me. So, excuse me.
Chuck, when you're done, Chuck has. No, when you're done, Paul.
Okay, so the passion here is, you know, we want to resolve this as much as you, but it's like, my God, I don't know where to turn. And I think you've got 2 people here with over 60 years experience dealing with this. We talked to another one with 30 plus years of experience, and everything I can tell, we're on the money what we're doing. So,
Chuck, go ahead.
Well, I mean, I don't think that's in question. I don't know about, I don't want to speak for Tweed or anybody else, but what I'm getting at is all this, absolutely. And if we have a way to fund that, that would be even better. But if we don't have a way to fund it, there has to be other counties that are having the same or similar situation. Because if we're able to fund it, and then we go bankrupt because we can't fund it because we don't have the capital or the money for the people doing this. And so all this, I understand it completely. That's not even in question to me, that what's going on, what the services are provided. My question is, how do we sustain doing this?
Well, I think that's what we've also been looking at, with dead ends, including having a consult with those three bigwigs from the state, from DHS.
Okay, Tom has the floor.
Yeah, thank you. Well, I'm happy to hear that you understand the issues. I think that was part of the reason of going through this exercise tonight, is just to make sure that you understand what great work these people are doing to help this population. But, you know, as you look at the green sheet, that is the cost driver, and that is the major problem. You know, the screen I have up here now is the fund balance in the Health and Human Services Fund. And you can see, and we talked about this at budget time last year, how, you know, the fund balance, again, the fund balance is the money left over. You know, you've got revenues and expenses, and if you've got more revenue than expenses, you're increasing your fund balance. So that's a good thing. So over the last, 5-6 years, that fund balance has increased to over $1 million. And we talked about this issue going into the budget season, that we knew we were going to have these excessive costs, but we had some fund balance that we could take a hit if it couldn't, the budget in the whole, if it couldn't get balanced. And in the past few years, they've been able to beat their budget even with these excessive costs, and so our fund balance has gone up. As we look at the end of 2020, that's not the case, because we, had over $1 million worth of these costs, which is higher than they've been, ever. So our fund balance is going to take a hit. So we can survive 2020, but we can't do that again. So as we look at the budget season for 2022, then this becomes a real, even more of a serious issue. This is our next $1 billion problem. And it doesn't have to be balanced. It's not about improving what these guys are doing that's going to solve the budget problem. This is, the countywide budget problem. So, and with levy limits, we can only do so much, property tax dollars, and that's about $10 million of our budget comes from property taxes. $1 million of that goes to the problem that we just talked about tonight. So, and we've got no choice in that, right? I mean, we've got to pay those costs. And so that $1 million hit that we're going to take it next year and the year after that if these people are still in these programs, which is fine if that's what they need, but how do we pay for it? And that's where we're limited on the state on what we can do. And we're looking at different options, but there aren't a lot, right? One of the things we did last year was starting to bond for capital items. That was to move some of those operating costs that we pay for outside of the levy limit so that we had enough room to pay for some of these things. That was a way to, use our levy limits to the highest potential. But, now what are we going to do next year? That's the next problem. So as we start talking about the budget for next year, we talk about all these other programs, and what's mandated and what isn't mandated. And it doesn't have to be just in Health and Human Services when we're balancing the budget. It's going to be, Sheriff's Department or Highway Department or any of the other departments. If we only have that much money, we've got to take care of business the best that we can. So, yes, glad we understand the problem. That's a very important piece of the puzzle, because as we talk about, either having to cut services or look for alternative sources of revenue, this is one of the main drivers on the issues that we have at the county right now. So, understanding the importance of what these things do, these programs, and how they affect the overall budget, that's what we're dealing with. So do we have answers tonight? No, but that's why I was pushing Paul so hard. It's like, okay, I mean, this is a big problem. Let's make sure that we understand what it is, that you've done everything possible to control these costs, and then we go on to the next thing. But we can't go on to the next thing until we thoroughly understand this thing. So that's where we're at tonight, and that's where we wanted to be. And we're rolling into 2022 budget before we know it, and here we go again.
Tom, I got a question. Can you answer Mr. Van Etten's question? Or other counties having this problem? Because I know you go to a county administrators team meeting, right? Where you meet with all these county administrators. And I sit with all the county board chairs on that Northwest Regional Planning Commission. And I ask the same question. These out-of-county placements are killing us. And I can't hardly get a rise in the room. from some of those other counties. So I don't think it is happening at every county.
Well, I just got today, I talked about this before at the county board meeting, how administrators have a group and through the state, we've all got together and tried to list our priorities. And the information I got today, the number one issue is mental health and crisis service funding. Number two is local options for, is levy limit flexibility, recognizing the inflationary costs of the operations that we do, because we're under those constraints. There's not even an inflationary number in our levy limits. It's just, it is what it is. And then the third number one issue is human services funding, juvenile justice, youth aids, child welfare, guardianships. So 2 out of the 3 top priorities around the state had to do with, mental health or health and human services issues. And that's a big part of, you mentioned the CAP team where we go down and talk to the legislators. It is an issue that they're aware of, and it's not, you just don't go down and knock on their door and get money. It's a big process, and there's competing interests. And even amongst the counties, there's different theories on how the legislation should be changed. So, you don't even have a united front amongst counties on how to solve the problem. I think we should do this, and I think we should do that, and they're competing interests. Well, how do you write legislation for that? So it's not just as easy as we need more money. It's harder than that, which is why it hasn't been done, because it is hard. That's my answer.
I can add, that's why I really appreciate how hard that process is, just by going through that CPS process for 4 years and see it out. Wix and WCA led that, and all the work that had to be done behind the scenes, it was difficult. And they're just starting out now with the mental health stuff. And one more thing to Mr. Manhattan's question. There is a northern county that's in serious financial condition right now, and they are going to go for a referendum to exceed their levy limit at the next election because their general fund balance is next to nothing, which is worse than where we are at. But we're, a year or 2 away of being in that same kind of situation. Our general fund, thankfully, in 2020 did exceptionally well because of sales tax came through. The economy actually held tight after there was that initial shutdown. We came out okay. So our general fund budget or fund balance is increasing, which may help to offset some of the funds here. And we're still kind of working through the year-end numbers. But we can't take another too many years.
Well, it's going to be good for now, right? We're going to have the same issue next year, the same issue after that. It's not going to end.
That is correct.
We can't borrow our way out of this.
Right, because there's a limit to that too. If you're going to borrow for capital, well, we borrowed for $1 million worth of capital. Well, we only buy $1 million worth of capital. So now that card has been played.
Right.
And so now, we're running out of cards to play to get through, right? Then we're going to end up at a cap that we can't get out.
Right, so what happens in 21 if we have another $1 million expense with this, and we have, what do we have in the fund balance, 300,000?
And that's a preliminary number that might not even hold once they get all the numbers in. So, yeah.
Supervisor Pettit.
Go ahead, Don.
Okay, I still was looking for an answer regarding the tribal contribution for the mental health. Do we have a number on that, Tweed, Lorraine?
I don't have a number on it, but I do know that we have programming. Joe, I'm not sure how many tribal members are served by this program we have now. I know we do have some. And I'm not really, I don't know the answer to that. I could find out though.
Okay.
And the other thing I wanted to add was Indian Health. We'll take a look and see what kind of.
Right.
But are there any grants or anything out there for mental health that can help address the needs?
I don't know. I have another, and I Googled from Mr. Schumann's rural communities facing exorbitant mental health cost. The barriers to mental health in an area, number one is the cost of mental illness to the counties, the rules, it's the number one thing. And then if you go to, actually, it's actually the Substance and Abuse, Mental Health Services Administration. They have a toolkit, best practice toolkit, and that's the number one thing that is also in that. So this is an ongoing issue across the United States. It's the rural communities and what has to happen. And if we have to be the front runner in this, and we make the waves, that we have to take a stance and say enough is enough. We have the tribal entity involved and we have the county entity. We cannot make it, my fellow chairpersons and committee. Something has to be done. We can sit here and argue and argue and argue about it, but the three people in the room that do HHS within that division know that no amount of money, it doesn't matter, like Mr. Schuman said, no matter any amount of money, it's going to go up next year. We have to find a solution. It might not be the solution that we want, but we have to find one. And if we have to be the leader in that, then so be it. If we have to and I know no one wants to go to the news, no one wants to do anything like that. I totally get it. But if you don't stop, if you just keep knocking on doors and you don't start kicking some, this is where we're going to be at. And then we're not going to have two of the people that lead this department within the county within the next 3 years. They will be retiring.
Okay, thank you. Paul, is there anything further you want to add?
No, thank you for listening.
Tom, is there any comments?
No.
Okay.
Oh, yeah, there was one other thing we all did together, is you did that resolution for Winnebago. So that's another thing we tried.
Yeah.
Oh, by the way, I didn't mention her name, was Haley Sands. I want to give her credit for putting this together. Okay.
Okay, so we're down to any items for discussion only. Pretty much discussed out. Is that it? Meeting's over.
Well,
Thank you.